This video will demonstrate how the module will flow. Sign the sign-in sheet at the left. No, yeah. This video is blah 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 and that's it. And then we'll do a separate video. Welcome to the local anesthesia module. So when you first come in, make sure to sign in the sign-in sheet provided. Have your competency forms for the maxillary and the mandibular ready, and have a consent form signed and ready to go. Alright, so we'll now go through the order of competency. So we'll first go through the maxillary injections, and we'll practice infiltrations, the anterior superior alveolar nerve block, the posterior superior alveolar nerve block, and the greater palatine. We'll then go to mandibular injections and practice the inferior alveolar nerve block, the gow gates, the mental nerve block, and the long buccal. And we'll then go to nitrous, where we'll practice sedation, indications, and we'll talk about complications. So when wearing PPE, there's a proper sequencing that we must follow. So you want to first start with your gown, followed by everything that goes on your face. So that includes your N95, your goggles and your face shields, and a hair bonnet. You can then move on to place your shoe covers, and finally wash your hands and place your gloves. So we'll go through a list on what to bring with you on the first day. So you want to first bring PPE. That includes your N95, your goggles and face shield, and your gloves, and you can get PPE from the dispensary. You can have your ID card and a blood pressure cuff to check vitals along with your stethoscope. And finally, you want all your forms, so that includes your competency forms, your signed consent form, and the information packet. Once you've checked in, partner up and set up 2 chairs.
So first, you're going to open your syringe. First of all, you have to make sure that you retract the syringe so that the cartridge would fit. Make sure when you're placing the cartridge that it's placed in the correct orientation. After placing the cartridge in the correct orientation, make sure that you properly engage the cartridge. After that, you're going to get the needle, you're going to properly open it. Make sure you fulcrum while screwing the needle in. After you're done with dispensing the local anesthesia on your patient, make sure to close the needle properly by using the scoop technique.
Once you're ready to proceed with the injections, a staff member will start to quiz you on information from the packet that you have. This will consist of information such as the gauge size, the landmarks, and needle depth, penetration. Not exclusive to any of these 3, anything from that packet can be asked. Once you have successfully answered these questions, then we will go on to demonstrating the skills, and you will then go intraorally and practice your injection. The staff member will always be there to help you and guide you in case you need it in finding the landmark and determining the right depth and aspiration technique.
When you're ready for your injection, remember to take off the cap and to keep the needle away from both you and your patient. Remember to aspirate twice, turning 90 degrees every time, and to keep your elbows tucked into your body. Don't flail your arm out, keep it nice and close.
Once you guys are done with your injections, you're going to sit your patient up slowly and tear down the chair. Make sure to remember that the needles go into the sharps container and the carpules go into the separate incineration container.
We'll review some anatomy starting with the PSA. The posterior superior alveolar nerve innervates the molars. However, in 28% of the cases, it does not innervate the mesiobuccal of the first molar. The MSA nerve will innervate the premolars and the mesiobuccal of the first molar. And the ASA will innervate the anteriors but in 72% of the cases, it will innervate the premolars and the mesial buccal of the first molar. The greater palatine will innervate the palate up into the midline and anteriorly to the mesial of the first premolar. And the nasopalatine will innervate the anterior portion of the hard palate between the mesial of both premolars. So now with the mandibular injections, the inferior alveolar block will anesthetize the mandibular quadrants except for the buccal mucosa around the molars. The long buccal block will anesthetize the area. The mental block will anesthetize the anterior up to the midline into the distal of the second premolar. And the Gaugates will anesthetize the complete mandibular quadrant. Before coming into clinic, remember to review your anatomy and review the injection videos to make sure you're successful in this course.